We know that over the past decades, we've really seen great improvements in concussion recovery care, how we help children and adolescents return to their lives after having this mild traumatic brain injury. And we've seen that we have pretty good guidelines around returning to learn, returning to exercise, returning to sport, but there are no guidelines on returning to drive after concussion. So essentially, they were going back to this complicated behavior of driving, which involves eyes on the road, hands on the wheels, and mind on the task of driving, when maybe they weren't quite ready for that yet. So we're looking at teens where they are in our driving simulator. So we have these highly controlled experimental drives where we're looking at both their driving behavior as well as where they're looking on the roadway. And looking at the comparison between teens who've had a concussion and those who haven't. We're using driving simulation, we're using an app to collect their driving behaviors, as well as their daily symptoms. So they're not expert drivers yet. So this combination of a mild traumatic brain injury, as well as returning to a behavior that was already potentially risky for them, is important to look at in an adolescent population outside of just adults. When I was working as a school nurse in the high school, we had 3 teen deaths due to motor vehicle crashes within a few years. And so these crashes that could have been preventable is an important and critical part of the work that I do and continue to do. I think that one day, the data that we're collecting and the results that we have are going to contribute to guidelines around returning to drive after concussion in adolescents. Nurses have a unique way of looking at the world. And so as we design our studies, as we collect data from our participants, as we work with our patients and families, the questions we ask, the way we make meaning of the data, is a unique way of understanding the patient experience. The federal funding to support the work around injury prevention is vital.